A lot of you already know that. And that's really all the house announcements. You're in for a treat tonight because you got 3 for the price of 1. Um, they are all residents who work at the UNMC Dental Clinic at Children's Hospital and Medical Center. Please welcome Drs. Elliot Bailey, Gary Lynn, and Carl Trout.
All right. Welcome. Thank you all for coming today, and thank you for tuning in online. We hope today's pretty informative. Hopefully it can answer some of your questions that you have, and maybe stimulate some other questions that we can answer at the end of the presentation. We have a short presentation, and it covers some of the basic stuff, but then it goes into some detail about some other good ideas for your kids. We're going to start off with something pretty basic. Baby teeth. Your kids will have 20 baby teeth, and they start erupting right about 6 to 7 months of age. You'll start to see the front lower ones, and then it'll progress to about 2 years of age, and there's a wide variance of when they erupt. Some kids get teeth as early as 3 months or even earlier than that. Some infants don't get their teeth until about 1 year of age. So the functions of the baby teeth, they are your first set of teeth. You get a do-over set of teeth with your permanent teeth when they come in later on. But there are a lot of functions, and they play a very important role in your child's life. One is they're able to learn how to speak properly. They can help build the child's self-esteem through their appearance. They do guide the jaw growth and maintain the space for the permanent teeth, and that's one of the very important functions for them. And then the obvious one, it's important for feeding and for the nutrition. Well, the teeth start to or begin development in the early stages of pregnancy, about 6 weeks. So it is very important to have good maternal prenatal care, since the mother's nutrition, general health, the medications she's on, and the oral health can all affect the tooth development in utero. At birth, the infant has deep in its jaws all the primary teeth and some of the partially formed permanent teeth. You can see on the picture the baby teeth here. This is of a 6-year-old. You can see the primary teeth here, and you can see the close association of the permanent teeth right beneath the baby teeth. We can go into prevention now. Brushing. Brushing is very important, as you all know. We do recommend to begin brushing at the eruption of the first tooth, or even sooner. I know they have some of those kind of rubber toothbrushes that fit over your finger, and what that does, the earlier you introduce it, the more your child's able to adapt to it, to get used to something being in their mouth. We do recommend brushing twice a day, as you guys all have heard before. And cleaning the child's teeth remains the parent's responsibility until the child is able to tie his own shoes. And this typically is about age 7. And what we see is that up until that age, kids can do a really good job brushing some of their teeth, but they just can't get to all the surfaces of all their teeth. And so it really does take their caregivers' help to make sure that all the surfaces are clean and to protect their teeth. We do recommend fluoridated toothpaste to protect the enamel of the teeth. A smear of toothpaste you can see on the lower picture, or you might not be able to see. It is a very, very small amount, and this is what we recommend as your child's beginning to learn how to spit. We recommend using just enough to wet the tips of the bristles, and then you can practice spitting with that. And what I like to do is kind of brush their teeth by the sink, and then they can practice spitting. But what they typically do first when they're learning how to do this, they'll swallow it and then they'll spit, and that'll be okay as long as you're using the very small amount. As they progress and they get a little bit better at it, you can use the classic pea size amount, and you can see that right here. As far as the technique for brushing, what's going to be important takeaway from tonight is we want to get everybody away from brushing their kids' teeth from in front. You really don't have control over their hands, their head, and this is mainly for the younger ones. For the older ones, you don't quite need that control. But then you also can't visualize all their teeth from in front. It seems kind of counterintuitive, but if you do brush their teeth from behind, as you can see for the young ones, for this one, I have her up on the bathroom sink in front of the mirror. They're able to see themselves in the mirror. You can demonstrate it on on a stuffed animal before you brush their teeth. But this way you can gently place her head in between your arm and your chest and hold her hands. And then that way you can visualize it, you have control, and even when you do get a stubborn youngster for this one, and they just refuse to open up their mouth and they're just refusing, what you can do is, a little trick is to just brush their lips. They get confused and they'll give you their front teeth, and then that's when you can kind of start brushing. Another way to do it is on the couch in your lap, and that's another way to kind of control their movements. And then as they get a little bit older, you can stand behind them, have them tip their head back, and it's really important to visualize the teeth, because if you can't see the teeth, if you're thinking you're getting all the tooth surfaces, you're really going to be missing them. And so visualize the teeth is going to be key. Flossing. This is something new for a lot of people, but we do recommend flossing right when the teeth start to touch each other. When the teeth touch each other in back, it's typically about age 2.5, 3 years old. The toothbrush bristles aren't small enough to get in between the teeth. And so those areas are never getting cleaned if we're not using a floss. One of the really nice things for people to use are these little floss helpers here. They sell them by the hundreds at the stores. They have different designs. I know they have some princess ones, and then you can see some animal ones here. And it's very quick. You don't need to floss in between all of the teeth right away. Kind of just get into that habit. Start these habits early. The earlier you start these habits, the more they feel that this is just how it's going to be. Every day we're going to brush twice a day. Every day we're going to floss once a day. And especially at the beginning, where you only have to brush in between the teeth that are touching, it may only be 2 to 4 spots where you really have to get it in. And you can kind of form it like a little game. I know with my kids, I let them do it first, and for when they get excited when they can get it caught in between the teeth and everything. So have them be part of it. Have them be an active participant in taking care of their teeth. As far as a diet, this is going to be a general overview, and hopefully you guys will have some questions as well about diet and the prevention aspect of it that we can answer at the end. We encourage you to instill healthy food selection, nutritious low-sugar snacks, and portion control at an early age to promote a healthy lifestyle practices. Just like with toothbrushing, with flossing, have it be this is how it's going to be. It's hard to change habits overnight, and so we want to strive for those good habits from the beginning. The growth spurts that occur between ages 3 and 6 years of age and the limited stomach capacity require the smaller portions during the day, so healthy snacking from a variety of foods will meet the nutritional requirements. Diet high in sugars can lead to tooth decay, but also place the children at risk for other serious health conditions like obesity, diabetes, and heart disease. And so the nutritious meals, adequate hydration, physical activities will help the children grow and develop to their full potential. Like I just mentioned, the diet high in sugar and other forms of carbohydrates may increase the probability of tooth decay, but sugar is found in more than just the candy. It's more than just the cotton candy, your Skittles. It's found in all the starchy foods such as chips and crackers. And diet drinks too. They may be sugar-free, but a lot of the diet drinks are very acidic, and that contributes to the tooth decay as well. Foods that stick to the teeth are also more difficult to wash away and therefore should be avoided for snack times. And these include one that a lot of people don't really think of, but dried fruit. Fruit is really nutritious. It does have some natural sugars in it, but fruit in its natural form will clear the mouth very quickly. And so it really doesn't cause the decay that dried fruit would. But what we see is that dried fruit will get on the teeth, the body isn't able to clear it, and so then that's when the decay process starts. And then, of course, juice. We see a lot of bad things can happen with juice, and we all know that kids love the juice, but it's important to limit juice to mealtime. We recommend no more than 4 to 6 ounces of juice a day because it does put your child at risk for cavities. Consider diluting juice with water. So if you have, for lunch, if you want to have juice, do just 2 ounces of juice with 2 ounces of water. And attempt weaning from a sippy cup at age 18 months, as it is best to give drinks in open cups. What we want to get away from is this all-day snacking on your juice, on your fruit snacks, on your crackers. It's really the frequency of the sugars that we want to really cut down on. And so what tends to happen is that we have juice in a sippy cup, and they're walking around with the sippy cup, and every time they take a sip of that juice, it's another attack in the mouth, and your body's trying to fight and clear that out of the mouth. And so your body's never able to keep up with that fight if they're able to walk around drinking the juice like throughout the afternoon. And so we do recommend, if it's in an open cup, typically a kid will be able to drink it all at once and be a little bit quicker at it, and they can't just walk around with it. And that's another reason why we want to limit those sugary foods to meal times, to lunchtime, to dinner time, and not for snack time. Because if we limit them to the major meals, there's other foods in those meals that will help clear the mouth. There's actually protective foods that will assist our bodies in protecting us. So some of those healthy snacks that we like to see kids eat for at snack time, they're your dairy products, your cheeses, your yogurts, your cottage cheese. They're the high protein foods, the nuts, the meats, and the fresh fruit and vegetables should be encouraged to be eaten with the meals and snacks to balance the sugar breakdown. So if you are one that has dried fruit for a snack, mix it in with some of your high protein snacks like peanuts. Those proteins, it'll stimulate the salivary flow and help the body clear it. If you're going to have crackers or those high starchy foods, mix it with the cheeses, and that'll also help clean the teeth. Sweets, obviously, they're going to be okay once in a while, but we want to get out from giving it for the high frequency, like snack times. And then how much sugar do these products actually have? I mean, if you look at the dried fruit like raisins, they have, if you think of those little sugar cubes, they have one serving of the sun-made raisins have 7.5 cubes of sugar. 1 20-ounce bottle of Mountain Dew, not only is Mountain Dew very acidic, but it also has almost 20 cubes of sugar. And then you have your classic Skittles example of 12 cubes of sugar. So kind of the overview, mothers should reduce their own oral bacterial infection. We recommend from when you get pregnant, even before, obviously before you get pregnant, when you're pregnant, to continue with your dental appointments yourself. I know life gets busy, especially that first year of after your baby's born, but try to hit those dental appointments, because the infection is a transmissible infection from mother to child. That bacteria in the mouth, when you're with your child, that's when the bacteria colonizes in your child's mouth is from you. So we want to limit the bacteria in your mouth to provide a healthy start for your child's mouth. Try comforting the child with a pacifier, a favorite toy or blanket, instead of using a bottle of breast for a pacifier. And this is another thing, part of that frequency. We want to limit the frequency of all these things. Obviously, feeding times, we know that's very beneficial, but as far as for pacifying your child, try other things. Clean your child's teeth as soon as they erupt, and after each feeding. Parents should use a damp cloth or a toothbrush to clean the teeth. I know there's times it's just unrealistic. If you just got the child to bed after 3 hours of trying to really wake them up and brush their teeth after that feeding. But just a warm water on a washcloth and just sweep out the mouth, because what happens is that milk will pool in their cheek and it'll stay on their teeth and could potentially cause cavities. Check the teeth regularly for chalky white or brown spots, especially around the gum line. Dr. Bailey will get into this a little bit more about what to look for. And then bring your child to a dentist whenever you think a dental problem is suspected. Whether it's they're starting to walk and they bump their tooth, it doesn't mean that anything's wrong, but we have the most options the sooner you're able to get them in. There's some situations where we can save the teeth more likely than others if you bring them in sooner. And then we do recommend the child's first visit to the dentist should be made by the first birthday. Those have been our recommendations for about 10 years now, along with the American Academy of Pediatricians. And what that does, it provides a dental home for your child, and Dr. Bailey will also get into that, on what all that means of establishing a dental home.
Okay, just a little bit about, I'll talk a little bit about cavities. Okay, we call it caries, but cavities is another name for it. We see a lot of this early childhood caries. That's what keeps us in business. Anyways, something you may not realize, it's very prevalent. Much more prevalent than a lot of other diseases that children have to go through. 5 times more common than asthma, 7 times more common than hay fever. In fact, dental caries or cavities is the #1 chronic disease for children. Okay, you might not realize that, but it is a form of a disease in that there are the whole reason for cavities, it is a bacterial infection around in and around the teeth that causes, just as if you would take your child if they had strep throat, things that infect other places, things like that. This is also a bacteria that likes to reside in the mouth. Okay, so it is considered a disease, and the caries rate, just so you know, 18% age 2 to 4 years old. 52% by age 6 to 8 have dental caries. 67% age 12 to 17 years old. So, and also another statistic, by the time a child reaches kindergarten, 40% have at least one cavity. So that's quite a bit. A lot of these kids we see, even earlier and earlier, can be even at age 1. I know we talked about bringing your child in early and probably not thinking that they have a whole lot to look at, but we do see sometimes children, even at that age, can begin this process, this destructive process of bacteria on the teeth. Cavities in the baby teeth affect a lot of things. First of all, they can affect the child's facial growth. One of the, by the way, this is some pictures of a fairly young child, and this is how bad it can get. And you would think that would be something that would take a long time to happen, but that can happen very quickly, because these baby teeth are not quite as protected as permanent teeth yet, and it takes some time to calcify those teeth. Anyways, teeth are very important for facial growth. They support a lot of other structures in the mouth. So if we lose some teeth prematurely, it can affect the way that the jaw grows, the upper arch compared to the lower arch. It can cause a lot of other growth problems in the future if we don't take care of these teeth and preserve them. Of course, it can cause significant pain. Just as you can see here, that is a picture of an abscess. I don't know if you can see that little, let me show you here, that little pimple. This is very common to have cavities that have reached the inside of the tooth and have gone into the bone, and that bacteria is trying to find a way out. And so that's what those little pimples are, as an abscess, a tooth abscess. And that we see a lot of kids, that come in. Eventually, they come in because they have a lot of pain, and they're missing several days of school, which, by the way, is the other cause. The #1 cause of missed days in schools is dental-related treatment. So besides just having pain, we can keep them in school, kids in school, if we take care of their teeth. It can potentially threaten a child's life. Like I said, the infection can get inside and into the bone. It can even get into the bloodstream and affect other parts of the body. There have been reports of even fatalities with dental caries as well. So it's not something to take lightly. Let's see. Like I said, tooth decay, it's an active process. It results from interactions between the tooth, food, and bacteria. So you need all these things. The bacteria feed on the food, and the bacteria cling to the teeth. So it's a perfect medium for the bacteria to colonize the mouth. Each time a sugary substance is put in the mouth, these bacteria then begin to grow and make tiny communities in between the teeth. As the bacteria grow and use this sugar, the byproduct of this is an acid, a lactic acid that destroys the teeth slowly, on some occasions, and very quickly. It just depends on the type of bacteria that your child may have in their mouth, and the type of nutrients that these bacteria are getting. Very common thing to know if your child is beginning this process of decay is looking for these white spot lesions. Okay, discolorations of the teeth that you may see can be dental caries. It can be some other things too, but you can kind of see, we'll show you pictures as well of kind of things to look for, early signs. Okay, that doesn't mean they're actually cavitated or cavities yet, in that they're not a hole yet in the tooth, but it can progress quickly to something like that. Okay. Plaque can also reside along the gum lines, along the gingiva or the gums, and contribute to oral discomfort. A lot of times we see kids that come in and we simply brush their teeth or do a simple cleaning, and we see a lot of blood in and around the gums. That's very common if we see a lot of bacteria get up underneath the gum pockets and cause irritation of the gums. That is one of the signs that we know, that these teeth haven't been cleaned as well as they should be. It's easy to brush along the tops of the teeth and on the sides, but you got to get underneath the gums as well, because that can cause severe pain as well. We see a lot of kids that think, and moms thinking that their teeth, it's a tooth problem, when in actuality it is a gum problem that's causing this pain. So again, the gums are important as well, so it's important to brush along the gum lines. And if you may have noticed this yourself or with your kids, when you're brushing, you may see a little bit of blood on the toothbrush. That doesn't mean you're necessarily brushing too hard. It just means that it can be a little cleaner in that area. Again, the bacteria needs to be dislodged from those gum pockets, so that over time, consistently brushing along those gum lines, those gums will heal up really nice. They'll be nice and tight, and won't almost like a little sore you get, or a scratch. You have to take care of it and clean it and eventually go away. Same thing with teeth and the gums. The gums, they will eventually be healed, and the gingiva will heal up, and it'll be nice and tight and firm and won't bleed anymore. And it'll be a lot less discomfort for the child. Cavities, of course, can lead to severe destruction. We showed a picture of that. Difficulty in chewing, poor nutrition, impaired growth, even language development. We talked about that too, missing school days, and again, life-threatening infections. This is an example, just some pictures of those white spot lesions that I talked about. It may be difficult to see in this, but there's a pointer right there, but some of this white, opaque discoloration, a lot of times along the gum lines again. Another thing to notice too is you see this kind of red halo around the teeth on the gum line. Again, that's indicative of inflamed gingiva or gum tissue that's not as clean as it should be. And so there's a lot of bacteria under there. More than likely, if you brush this child's tooth, then there'll be a lot of bleeding. But you can see these white spots all over these teeth. Those are beginning. What has happened is that acid has destroyed a little bit of the enamel that's on the teeth. And enamel is nothing more than a crystallized structure. When acid gets in contact with it, it begins to decrystallize or decalcify that tooth. It can eventually turn into something what's on the right. It begins to stain, it begins to cavitate into the tooth, or in other words, erode into the tooth. And again, it's a perfect place for more bacteria to reside. And again, start communities of bacteria to then lay down more acid. So this is an obvious sign of cavities. And again, it can get into the middle of the tooth and eventually affect the nerve of the tooth. So these are things to look for. Again, an important thing to do is to brush with fluoride toothpaste, because we have the ability, if we see these white spot lesions, we can stop the progression of getting to what it looks like on the right if we maintain good oral hygiene, and fluoride actually acts to counteract those white spot lesions if we're diligent in brushing and maintaining good oral hygiene. This is another example of how cavities can progress. You see this, first of all, right here, the arrow, kind of a dark stain. There's grooves and fissures on, this is a molar tooth, that's a baby molar tooth in the back. You first will notice maybe some dark staining. Well, first of all, it's hard to see this in your child's mouth. It's really difficult to get back in there and look. But this is a very common thing that we see is the beginning of just a stain, a perfect place for bacteria to hide out. This can eventually turn into something much bigger very quickly and begin to cavitate inside the tooth. That inside of the tooth is all soft and can be easily removed. Because as the acid is eating part of the tooth, then the tooth becomes softer and softer. And so it eventually, we see a lot of this in our clinic too sometimes, is it can affect all sorts of different teeth, different sides. And at this point, treatment becomes a little bit more difficult for the child to endure if we catch it early as something like this. Much easier to take care of something like this than something like this on the right. Like I said, this can progress quite rapidly if we don't take care of it quickly. And Dr. Trout will talk a little bit about some trauma issues.
We can go back there. There we go. So I'm just going to talk briefly a little bit about traumatic injuries in the primary teeth or the baby teeth. The prevalence of traumatic injuries in ages 0 to 6 years of age is in this group is about 11 to 30%. So it's actually quite common. And I think we've all probably been around children or interactions with our own or with nieces and nephews, and they're all out playing and one falls and slips or bumps into the other one and they hit their 2 front teeth. And that's what a lot of primary baby teeth trauma is related to. The incidence of trauma doubles in children as they begin to learn to walk at 18 to 30 months. And then we'll talk about 2 specific types of trauma, intrusion and avulsion injuries that are the most common injuries in children under the age of 2. Injuries to the baby teeth, and this is why it's so important to keep this in mind, and is that injuries to the baby teeth do affect or can affect the development of the permanent teeth that is in the jawbone underneath the baby tooth. And the most common related problem is it causes a discoloration to the front tooth of the developing adult tooth underneath the baby tooth. So we'll just kind of move on to the types of trauma. One of the most common trauma is what we call a tooth concussion. And this is basically a direct trauma to one of the front baby teeth. And the child simply is learning to walk or playing with siblings, and they fall and they hit those 2 front teeth. And it doesn't displace the baby tooth from the socket. It just causes a blunt injury to those teeth. And it might be accompanied with bruising or a little bit of bleeding around the gum tissue of the front teeth. And really, there's not a whole lot that you do for those. Just reassure the child, comfort care, provide, say, children's Motrin and a popsicle to help reduce the inflammation. But really what we're really looking for is to make sure that they didn't damage the inside of the tooth. So a lot of times parents will bring a child in and we'll take an x-ray of that particular tooth just to make sure that they didn't fracture the root of the tooth or displace it at all. And most common thing we see with those teeth is that they tend to change color. The inside of the tooth, the actual nerve and blood vessel, the pulp of the tooth gets bruised and it changes the color to a grayish, sometimes an even darker brown color. And those usually lighten with time. So we can see here this little one bumped one of the front teeth and it turned gray here, and then with time, after several months, it actually lightened out a little bit. And there's not a whole lot else you do for those. It's just monitor them. When you're brushing your child's teeth, just kind of look along the gum, visualize, make sure you don't see any signs of infection. Make sure they're not complaining about it. If there's any swelling or something, you should give your dentist a call and then go in and have it checked out. The next trauma is what we call a crown fracture. Again, very common injury. We see this probably quite regularly every week in our clinic. Child are playing, they fall, they chip off a corner of the tooth or part of the tooth. They can be to varying degrees. A lot of times the simple little chips can be fixed either by smoothing or recontouring that tooth. And sometimes we can use a white resin tooth filling material to remake the tooth for them and make it look like the one next to it. And then there are, of course, the severe crown fractures here where this little guy pretty much split the tooth in half, and it looks like it's probably gotten infected at that point. And for those teeth, unfortunately, we need to remove to prevent further infection. Okay. So here's a common thing we hear from playground instructors or the school nurse or the parents. My child lost his tooth on the playground, and basically this is how they present. And what's really actually happened is here was the baby tooth here. Here's the adjacent baby tooth. And they've fallen and hit it and shoved it up in through the socket. And this is called an intrusive injury. So they didn't knock this particular tooth out. They just pushed it up. Intrusive injuries are direct trauma injuries that push it up into the socket. Usually, if it's a simple intrusion where the tooth is just pushed up slightly, we can monitor that and the tooth will often re-erupt and everything checks out pretty well. If it's really pushed up or damaged, like in this picture over here, often those teeth need to be removed. We'll usually after we do a physical examination of the child, we'll take an x-ray to confirm its relationship to the developing permanent tooth up in the socket, above the socket, and make a decision from there. The next tooth trauma is what we call luxation, and that's a direct trauma where the tooth is displaced outside of the socket. So it's actually pushed forward or back or to the side. So you can see in these pictures here, these teeth have been displaced here on the left, back in towards the child's mouth, and then on the other side, coming out and up. Those can be associated with a fracture of the bony socket as well. Usually, again, after we examine the child, we'll take an x-ray to confirm the placement, and often these teeth can be repositioned, and sometimes we'll splint the teeth, and that'll help hold them in position so that they have a chance to heal. If we feel that they are too loose or knocked out in an unfavorable position that wouldn't allow them to heal, we would probably recommend that they be removed. If they're extremely loose, they can also pose an aspiration risk for the child, where they could roll around in bed, dislodge the tooth, and end up inhaling it into the lung area. So our next trauma is avulsion of a primary tooth or the baby tooth, and that's where the tooth is completely dislodged from the socket. I apologize for some of the slides. I know they're a little bit much to take, but in this particular instance, the baby tooth was completely knocked out. And unfortunately, when baby teeth are knocked out, we don't try to reimplant or replant them because they usually result in an infection, damage to the jawbone, or damage to the developing permanent tooth up in the jawbone. And they can cause extreme pain for a lot of children if you try to do that. So we just keep them out. Again, it's a comfort care, children's motion, anything to reduce the inflammation. Sometimes a popsicle is the best solution to that. And then we'll talk about one more trauma, and that's avulsion of a permanent tooth. Avulsions commonly occur in children between 8 and 12 years of age. The goal of this type of injury is usually kids are playing at a playground or out front of the house, and and they fall off the bike or whatever, and the front tooth gets knocked out, the permanent front tooth. And the goal is to locate the injured tooth as quickly as possible. So after you've decided that your child's tooth has been knocked out, try to locate it as quickly as possible. Place it in a cup of milk. They've found that milk is a great storage medium to try to preserve the cells on the outside of the tooth root, and keeps them intact in order so that the tooth can be reimplanted back into the socket. Another alternative storage medium, if you're out somewhere where there's no milk, is you can actually store the tooth in the child's saliva. So you can have them actually spit into a cup and then set the tooth in the saliva, and that will help preserve it as well. You should certainly call your dentist's office and then report there immediately. So give them a heads up and then jump in the car and try to get them there as quickly as possible. I'm going to try to get these teeth back in within 30 minutes after they've been knocked out. So we'll just take a quick look at the slide. Again, you can expect at the dental office that we, of course, do a physical examination, look for other injuries to the oral cavity, to the jaws, take x-rays to make sure that other teeth weren't fractured or broken, that the jaws aren't broken, and then we'd immediately place the tooth back into the socket and stabilize it with a splint that you can see here on the right. So knocked it out. Here's what the x-rays typically look like. Hopefully the tooth is preserved in a storage medium. We'd take that and reimplant it and then make a splint to hold it in position to stabilize it for healing. And then there's quite a bit of follow-up care involved with preserving a tooth like this. So there'll be a number of steps involved to trying to save that tooth, but the best thing you can do is locate it as quickly as possible, get it in that storage medium, whether it's milk or saliva, and then get to your dentist's office as soon as possible. All right. And the last topic we're going to talk about, and this is probably the most important message that the three of us can deliver to all of you tonight, is the establishment of a dental home. And basically that means having your child's oral health care delivered in a comprehensive, continuously accessible, coordinated, and family-centered way by a dentist. This enhances the dentist's ability to assist children and the caregiver in their quest for optimum oral health. And basically that means just choosing a dentist to establish care for your child, going there for that age 1 dental visit right off the bat, getting to know the dentist, the staff, just coming in and visiting. We provide advice, what we call anticipatory guidance, to guide parents and children as they continue to grow and change, to have the best chance at optimum oral health that they can have. So it also provides parents can avoid their child from contracting, as Dr. Bailey talked about, early childhood caries. It gives us an opportunity to really head that off in a good way with proper nutrition counseling, early preventative techniques that you can use for your child, like Dr. Lynn talked about. Because early childhood caries is such a devastating and painful process for a lot of kids. It affects their ability to thrive in this world. So the dental home also provides a comprehensive oral care, including acute and preventable services, or prevention services. Comprehensive assessment of oral health, disease, and conditions, the anticipatory guidance about growth and development issues, teething, digit habits, pacifier habits. We can plan accordingly so that you have a resource if there's an acute dental trauma, like an avulsion of the tooth. And then we can provide information about proper care of children's teeth and gums, including maintenance of function, aesthetics, and of the tooth structure, dietary counseling. And then as children meet certain oral health milestones, they may require dental specialty services. And we're certainly, as pediatric dentists, available to provide referrals for any kind of dental specialist that your child might need. So here he is, starting out to give your child a healthy smile. So Dr. Lynn's beautiful children there. So that pretty much concludes our presentation. Thanks for coming in and lending us your ear and allowing us to present that. Hope it was. Some of the slides I know were a little bit scary. I apologize for that, but I think it's important for a lot of parents to realize some of the potential things while your child's developing. Right now, we'd like to fill any questions that you have. If you guys have anything for us, yeah, go ahead.
You were talking about. Oh, I get a microphone.
For
oh,
the,
good God.
the others.
Thank you. Is it? Oh. Yeah. Is it working? Should my voice be amplified?
Yep.
I have a 2-year-old, and brushing his teeth. You got into it with your little girl. He bites constantly on the toothbrush, and if I try to open his mouth with my hands, I get bit. And it's a constant battle every time we brush his teeth. Is there any recommendation you have on getting him, our toothbrush, we go through toothbrushes like crazy with him because they get bit up.
One thing, and this isn't going to work for everybody, but I mean, as a father, I've had to deal with that quite a bit. Just trying to be consistent, let him know that him doing that is not going to win the battle of brushing. What I like doing is, when they do start to bite down, I just twist the toothbrush, and what it does is it'll gently stimulate them, let them know like, oh, I'm not supposed to be biting on this. But as far as going through toothbrushes, that's just something you're going to have to try to outgrow for him. But that'd be my recommendations to kind of start there. Definitely don't put your fingers in there. You don't want to get bit, but if you gently twist it, it'll stimulate them to open up a little bit, and then you can hurry up and get another 5 seconds of brushing, and then he'll bite down again and kind of go through that process.
Sorry, I had okay, so we get there, but we don't, I know it's recommended 2 minutes, but it's like, I can't go any more than maybe 30 seconds, and it's like a quick, so I don't know if I'm ever getting all the food off, in his mouth or whatever, if I'm really properly brushing his teeth, because he won't even let me see his teeth. So just keep doing that until eventually he just subsides and gives up, I guess.
That's yes and no. To brush a 1-year-old to 2-year-old's mouth for 2 minutes, I mean, that's a feat I haven't exactly even met myself. Knowing that I'm getting in there, knowing the hardest areas to clean are going to be the insides of the teeth, and try to start there. The easiest parts are going to be your front teeth. So I end with the front teeth. I start with the toothbrush in the back by the tongue, because that's where the kids typically get the most sensitive. So I try to get that out of the way first, and then I move to the top and try to play a little game. It tickles a little bit more up there, so kind of mention like, oh, does it tickle? Not. But really to brush the teeth twice a day, every day, with everything going on in your life, everything going on with his life. Sometimes he's had enough. Sometimes he came back from a trip late. It's in my experience, it's not realistic to get that perfect brushing every day, twice a day. But the important thing is to try twice a day, and to let him know that you winning the battle is not getting that perfect 2-minute brushing. You winning the battle to him is getting that toothbrush in his mouth. And so that's what we want to start with, and then hopefully overcome those difficulties. Anything else?
You covered it pretty well. Do what you can.
It's a challenge.
Yep. It's just being vigilant and continue to reinforce it. Yeah.
Mm-hmm.
I already have a little thumb sucker, and I've heard that can lead to buck teeth. Is that true? Well, he's in my but he's usually sucking.
Yeah, I have 3 little thumb suckers right now, all 3 of them. It can, but we have to remember that pacifier habits, the finger habits, the thumb habits, they're all classified as non-nutritive sucking habits, and they are considered normal at first. The vast majority of kids outgrow these by age 2, and then the next step where they outgrow them is when they start school and they get that peer pressure. They realize, oh, that's not something I should be doing. I personally, I wouldn't worry about it at a very early age, and that's another very important part of establishing a dental home, so you can get those questions answered. There's some extensive things that we can do to try to stop the habits, but we want to start with non-invasive techniques. Positive reinforcement, setting up a calendar, and these are all things that your dentist can kind of go through. But it can prolonged forceful habits like those can cause the buck teeth, but it's much later on than your child's age right now. Oh, sorry.
We've been brushing our son's teeth since he was about 4 or 5 months old. He's just turned 3 last week, and we've been using the Oral-B toothpaste that does not have fluoride, so that we didn't have the whole spitting issue. But it sounds like you do not recommend that. What would you suggest instead?
Really, for all the toothpaste that are out there, in my opinion, they're all created equal if they have the fluoride in it. Your adult toothpaste typically are just a little bit more abrasive to the teeth, which if you're being soft, I don't think there's a big issue there. But starting off with that small kind of just wetting the tips of the bristles, just to make sure he is going to spit it out. Some kids love the flavored toothpaste, and they won't have anything to do with the mint or the spearmint or the cinnamon or the classic adult toothpaste. And so that's why they make the child's toothpaste in strawberry bubblegum, to make it be something that they like to have in their mouth. But with that being said, we also don't want them to swallow it because it tastes good. So I would start, because it's something you probably already have, with your toothpaste, and see if that's something that they can tolerate. My oldest daughter always asks for my toothpaste. She hates the flavored stuff. So I would start there, very small amount, and take it from there.
Not necessarily.
Yeah.
I think the most important message that we can get out is, it's like when Dr. Bailey was talking about the buildup of bacteria in the plaque that surrounds the tooth. The most important thing is actually the mechanical action of getting the bristles on the toothbrush. So if you guys are vigilant or hyper vigilant about always brushing his teeth, morning, after meals, or at least twice a day, you don't necessarily need to switch your toothpaste up until he's achieved that spitting thing. For a lot of high-risk families or high-risk children, we do recommend the smear of fluoridated toothpaste, just because that extra fluoride is just another part of our armamentarium to try to reduce that white spot lesion, the enamel breakdown. So if you guys are hyper-vigilant and not a big family as far as with the juice and consumption of high carbohydrate snacks and stuff like that, I think continuing with the Oral-B children's toothpaste that's non-fluoridated is fine until they've mastered the spitting action, the not swallowing. Yeah, it's fine.
When would you suggest starting to floss and use the mouthwash for the children?
Yeah, as far as flossing, we always recommend that any time two of the teeth touch together, whether it's front teeth or back teeth, you should begin flossing your child's teeth. We showed you a picture of those bow flossers with the neat little animal hand holders on them, or string floss. The hand ones work really well as far as both for the child and for the parent to get in there and just dislodge the food or the built-up plaque that gets trapped in between those teeth. So anytime that two teeth touch and form a contact together, that's how food gets lodged in between. So you can get in there with the floss and go ahead. So you just need to look in there if the teeth have pushed together or if they erupted in that way where they're all touching, you can go ahead and floss in between all those. And just getting in there and just simply sweeping and dislodging that will really help reduce their risk of getting cavities in between the teeth. So really, it's not an age-based thing, but where the teeth are actually positioned, okay?
Okay.
And as far as using a mouth rinse, for me, is whether it's a child's mouth rinse or it's more of an adult version, I always recommend not until the child has mastered that spitting process on their own, okay? They do make a lot of great kids products out there, children's mouth rinses, that you can try them out on to and see if they're getting it all out. But we certainly wouldn't want children ingesting any adult, especially the alcohol-based mouth rinses. Okay? Does that sound?
And as far as the flossing goes, I know we just got our daughter into actually brushing her teeth by herself. I guess how would you introduce flossing? Do you just go at it? Like, I'm very vigilant with brushing and flossing my own teeth, and she never really showed much of an interest in brushing her teeth. So I guess to get her to floss would be just as hard as getting her to brush.
Yeah, we use a concept in pediatric dentistry called show, tell, do a lot. And that's basically you can demonstrate for her how you floss your teeth or using those simple children's flossers on your own teeth and instruct her on how to do that. And then let her play around with it and develop the hand-eye coordination enough to do it. So you should do it first, and she can visualize you doing it in the mirror. You can show her on your own teeth. You can do your whole oral care together as a family or with you and her, and then demonstrate it for her, and then have her give it a try and play with it and try to get in between each individual tooth. Okay. All right. Any other questions for us? Well, once again, thanks to everyone for coming. We certainly appreciate it, and thanks for inviting us down to speak about our topic that's very near and dear to us, and that's keeping kids with healthy smiles. So,
Thank you. Thank you.
cool.